Good afternoon, everyone. My name is Peiling. I'm a MSc Counselling student at Bangor University. Today I'm going to present my dissertation research on Chinese international students' mental health in the UK. More specifically, I will be looking at three factors: acculturation, difficulties, language barrier, and help-seeking intentions. This is a pre-recording presentation. I hope you will watch it all the way through, and if you have any question after watching it, please feel free to email me. My email address will be in the video descriptions and on the final slides. So, let me start with a quickly outline of what I will cover today. First, the background and why this research matters. Then my research questions and the hypotheses. The methods I use, the results, this is the main part, followed by discussion and implication, and finally, conclusion and limitations. Let me start with some context. According to UKCISA, in the 2022-23 academic year, the UK hosted over 750,000 international students, and Chinese students represent the largest proportion of the population. Previous research has shown that acculturation barriers, things like adapting to a new culture, new social norms, and new academic systems, are significant links to mental health problems. On top of that, international students often face language barriers, limited knowledge of local service, and cultural schema around mental health. The idea that seeking help means losing face. However, most existing studies has been conducted in the US or Australia, not the UK. The UK has a different higher education system and a different healthcare system like NHS and a different visa environment. So we can't simply assume that findings from the other countries apply here. This is the gap my research addressed. To address this gap, I formulate three hypotheses. So hypothesis 1, acculturation difference will be the positive associated with psychological distress. So in plain English, the harder it is to adapt, the more mental health problems students report. Hypothesis 2, awareness of university counseling service will positively predict the help-seeking intention. In other words, if students know that free counseling existed, they will be more likely to use it. Hypothesis 3, so higher perceived language barrier will be associated with a lower help-seeking intention. So if students worry about their English levels or their language levels isn't good enough for counseling, they will less likely to seek help. Now let me walk you through my research method. I use a quantitative design with the online questionnaires. Why quantitative? Because I wanted to measure the strength of relationship between variables. How much the acculturation difficulty actually correlate with stress? That's record numbers. So for participants, I recruit 120 Chinese international students currently study at the UK university. This is including undergraduate, postgraduate, and doctor level students. So all participants were aged 18 or older, and all self-identified as Chinese. For recruitment, I use multiple channels like WeChat group or Renos. Those are Chinese social media platform. I also use the university Sona system. That's where psychological students can sign up for studies. And I use word of mouth, ask friends to share the link. A quick note on the sample. 120 participants is a modest size. Is enough to deduct the moderate correlations, which I found, but not large enough for more complex analysis like structural equations modeling. I will come back to this in the limitations. I used 4 standardized measurements plus 1 single item question. First, accultural difficulties was measured using the SCAS developed by Ward and Kennedy in 1999. This is 29-item scale. Example items including making friends and understanding local value systems. It used a 5-point scale from very difficult to very easy. Second, psychological distress was measured using DAS 21. I believe everyone was familiar with this. So this is a 21-item scale widely used in clinical and non-clinical populations. It has 3 subscales: depression, anxiety, and stress. Each item is rated from 0, didn't apply to me at all, to 3, applied to me very much. Third, language barriers was measures using a self-developed 4-item scales. For example, I worry about that I might be misunderstood when speaking to a counselor in English. One positive words item, like I feel confident express my emotions in English, was reverse scored. This scale used a 5-point link scales from strong disagree to strongly agree. Fourth, help thinking intentions was measured using the GHSQ, the General Help Seeking Questionnaire, developed by Wilson and colleagues in 2005. Specifically, I used a single item asking about willingness to seeking help from a mental health professional, psychologist, social worker, or counselor. This was rated on a 4-point scale from extremely unlikely to extremely likely. Finally, awareness of university counseling service was assessed with a single question. Are you aware that your university offers free mental health support, well-being, and counseling service? The response option was yes, and I know how to assess them. Yes, but I'm not sure how to assess them. I've heard about them, but don't know the details. No, I didn't know this, and prefer not to answer. For data analysis, I use IBM SPSS statistics. I conduct 3 types of analysis. First, descriptive statistics, so means and standard deviations. This tells us what the average score was for each variables and how much variations there was among participants. Second, Pearson correlations analysis. This tests whether 2 continued variables are related. For example, as acculturation difficulties increase, does psychological distress also increase? The correlation coefficient R tells us the strengths and the directions of the relationship. I use this to test hypotheses 1 and 3. Third, a one-way ANOVA, or analysis of variations. This compares the means of continued variable across 3 or more groups. I use this to test hypothesis 2, compare healthy thinking intention, assess the 4 levels of awareness of counseling service. Regarding missing data, not all participants answer every questions. I use pairwise deletion, which means that for each correlations, I only use participants who had data for that specific pair of variations. This is why the sample size varies slightly across analysis, from 66 to 79 participants. Now, let's look at the descriptive statistics. Psychological distress measured by the DASS-21 had a mean score of 19.60. The possible range is 0 to 63, so this fell in the mild to moderate range. That's concern but not severe. The standard deviation was 11.8, which tells us that was quite a bit of variations. Some students score very low, some quite high. Acculturation difficulties measured by the SCAS had a mean of 18.6 out of the possible 145. So the average student reported moderate difficulties. The standard deviation was 18.7. Language barrier measured by my 4-item scale had a mean of 30.8 out of 20. The minimum score was 4, the maximum was 20. So on average, students reported moderate language barriers, not severe but not trivial either. Health thinking intention measured by the GHSQ had a mean of 2.3 out of 4. On the scale, 1 is extremely unlikely, 2 is unlikely, 3 is likely, and 4 is extremely likely. So the average of 2.3 means participants were slightly below likely. Trend 2 was unlikely to seeking professional help. So in summary, moderate levels of distress, moderate adaptation difficulties, moderate language barrier, and a tendency not to seeking help. Now, for the main findings, start with the correlation analysis. Hypothesis 1 was supported. The correlation between acculturation difficulty and psychological distress was R equal 0.301 with a p-value of 0.014. What does R equal 0.301 mean? In simple terms, it's a moderate positive correlations. When one variable goes up, the other tends to go up as well. In practical terms, students who report more difficulty adapting to British culture, things like making friends, understanding local humors, dealing with people in authority, also reported higher levels of depression, anxiety, and stress. This is consistent with what previous research like Zhang and Guozhang found in their 2011 review. So hypothesis 1 is confirmed. Hypothesis 3 was not supported. The correlation between language barrier and help-seeking intention was R equals 0.044 with a p-value of 0.708. This is essentially zero. This is no relationship. Language barriers, at least as I measure them, do not predict whether Chinese students are willing to seek professional help. Additional finding. I also find acculturation difficulties and language barrier with significant correlate minus R equal 0.263 and p-value is 0.3. This makes intuitive sense. Students who struggle with cultural adaptations also tend to perceive greater language difficulty. These two challenges go hand in hand. Now for hypothesis 2, which tests whether aware of counseling service predict help-seeking intention. I use a one-way ANOVA to compare 4 groups. Group 1, yes, and I know how to assess them. 23 students mean help-seeking intention equal 2.39. Group 2, yes, but I'm not sure how to assess them. Is 31. Students mean is 2.13. I've heard about them, but don't know the detail. 19 students means is equal to 2.2221. Group 4, no, I didn't know this. Only 2 students means equal 3. If you look at these numbers, you might notice some interesting. The 2 students who has no aware of counseling service actually reported that highest help-seeking intention is 3, which is likely to seek help. But before we draw any conclusions, there was only 2 people in that group. That's not enough to be reliable. It could be random variations, or it could be that those 2 individuals has something unique about them. We need a large sample to explore this further. The ANOVA result of 3,71 equals 0.677, p-value is 0.569. The p-value is 0.569, far above the convention significance threshold of 0.05. That means there's no statistically significant difference among the 4 groups. In plain English, whether a student knows about counseling service or not, and how much they know doesn't affect their willing to seek professional help. Hypothesis 2 is not supported. Let me summarize hypothesis testing result clearly. So hypothesis 1, acculturation difficulties are positive or associated with psychological distress. So it's supported. P-value is 0.014, which is statistically significant. So hypothesis 2, awareness of counseling service predict help-seeking intentions, was not supported because p-value equal 0.569, not significant. Hypothesis 3, language barrier are negative associated with help-seeking intentions because results is not supported. P-value is equal to 0.708, not significant. So only one of my 3 hypotheses was supported. That might seem disappointing at first, but in research, non-findings are also findings. They tell us something important. I will explain what in the next slides. So why were hypotheses 2 and 3 not supported? Let me discuss each one. First, why didn't language barrier affect help-seeking? One possible explanation is the sample characteristics. All participants were enrolled in UK degree programs, which require English proficiency tests like IELTS test, using a minimum score of 6.0 or 6.5. So this student English is already good enough for everyday daily communications, including potential SCAS counseling service. A second explanation is that many UK universities now offer multilingual or online counseling options. So some are access to interpreters. Some offer text-based counseling where you don't have to speak English face-to-face. Those options may reduce the perceived impact of language barrier. And third explanations, and this is something future research could explore, is that language confidence might matter more than actually language ability. I measure perceived language barriers, not actually English proficiency. Second, why didn't aware of service affect help seeking? This finding tells us something important. Knowing that service exists doesn't mean people will use them. There's a deeper barrier, and most likely one is cultural schema. In many Chinese cultural contexts, mental health problems are seen as a sign of personal weakness. Seeking psychological help is associated with losing faith or bring shame to the family. Even if a student knows that free counseling is available, they may choose not to use it because of what others might think. Interestingly, the 2 students who had no awareness of service, the one who said no, I didn't know it, report a highest help-seeking intention. Is this possible that not knowing about service means that they also haven't internalized the schema? This is just speculations, but it's an interesting pattern worth investigating in future research. Practical implications for university. First, university should provide targeted support during the initial acculturation period. The first few months are when adapting difficulties are highest. Orientation programs, peer mentorings, and cultural adjustment workshop could make a real difference. Second, increasing awareness of service is not enough. Universities need to actively address cultural schema. This could be done through psychoeducation, normalizing mental health struggles as part of international student experience. Guest speakers, student testimonials, and cultural adapting message could help. Third, offer Chinese language counseling or access to Chinese-speaking counselors may reduce the process schema. When they help share your language and culture background, it can feel safe to open more. Chinese international students are not a problem to be solved. They are a valuable part of UK higher education, but they face unique challenge. Understanding those challenges are responding to them in culturally informed ways. It's not just good for student mental health, it's also good for university. Thank you for watching. I would like to thank my supervisor, Professional Fei Short, and all the participants who took the time to complete my questionnaires. If you have any question about this study, please feel free to contact me by email. Thank you and goodbye.